It's probably been about 10 years since I shot a video on lip enhancement, but I think it's worth updating and my thoughts and also consolidating them. Lip enhancement is one of the best things I do. It makes people look better, but it also can be, as you know, you probably see people walking around town, one of the #1 reasons why you don't go and see a doctor, because the person looks like a duck, they look freaky, they look scary, they don't look youthful. And the sad thing is a lot of women that do this, they don't even know they look this way, they just look weird. And so my goal is to impose forcefully my will upon you not to look crazy. So I talk about green, yellow, and red light things. Green light means you'll look better, it's worth it. Yellow light means it's going to help you a little bit, not much. And red light means, sorry, you can't have it. And when we go into the red light area, I'm not going to give it to you. So I want to give you my philosophy about lip enhancement. Lip enhancement, to me, should first and foremost match the age. So what age matching means, if you're 20-some years old, I can create a really robust lip, very, very full lip, and make you look natural 100%. But as we get into our 30s, 40s, and 50s, each subsequent decade, you cannot make your lips too large or they will not look right. So I always say age-appropriate lips. And the other thing that's important is I don't think lips are as much of a priority as most women think. Because women say, you know, my lips are what create femininity. No, it's your face. Your lips are a byproduct. It's a byproduct or a small component of the total picture. So when I prioritize making someone look better, I usually, unless they're 20-some years old, I usually bring the lips as less important in general. Unless I look at you and your face looks truly youthful, then the lips may take precedence. The other thing important besides age-appropriate lips is how the lips will match the face. So let's go back to that concept of age-appropriate lips, because that's also going to be talking about matching the face. Is that if you have a very full lip in an old face, it doesn't look right. So what I typically do in sequential fashion is I build the face first to make it look relatively more youthful. I can't make someone look 20, and most people don't care to look 20, but if I can make someone move this much more youthful, then I can take the lips and make the lips this much more youthful. But if you stay here and aging it, and I make your lips look 25, and you think that's what you want, and your face is not 25, you will look like a freak, okay? So that's the first important thing. The second important thing is making the lips match the face. So what that means is that if you have a very wide mouth, I don't want to exaggerate the width. If you have a narrow mouth, I may increase the width a little bit. That's about design and proportions so that the lips make the face look good. Sometimes certain ethnicities, African American, Hispanic, and Asian, may not look that good with very full lips because it can over-exaggerate ethnic features. So part of what I do is try to give you good counsel about what would make the most sense. The next question is, what are the importance of making a lip look natural? Well, first, let me tell you what looks horrible, and I almost never do it. I say almost never because always maybe one incident where I do it. Borders, okay? I know women love borders, and then they overpaint their borders. Please, when you go onto the white lip or right at that edge, you look crazy, okay? If you don't think you look crazy, please don't come to me asking for a border because I'm not going to give you a border. Borders look crap, okay? I repeat, garbage, crap. I don't do borders. They don't look good, especially on the top lip. Insanity, all right? Don't come to me. If you want a border, go somewhere else. It's going to make you look crazy. So when I go into the meat of the lip, what I want to do is design it in a way that it's not one solid piece. I do a 3-part fold. The bottom lip has a cleft, and it has this taper heart shape that's really beautiful. The other thing I have heard women ask me is, my lip is a little asymmetric. I will make it more symmetric, but I cannot get evenly symmetric. Especially when you smile, there's a dynamic pose. Like when I smile, I pull with my left side. Well, I'm not going to make a dynamic smile equal because I have to paralyze your face to do that. So what I'm doing is I'm just making it better, but I can never make symmetry perfect because women look too close to the mirror trying to figure out what is the problem. I want to design a lip that makes sense, okay? The other thing is a lip has got to taper to nothing like this. When it looks like it's bulgy all the end, it looks weird. So please don't ask me to fill in a little gap here because it won't work, all right? So you need to have a lip taper. When it hangs, it looks fake. How do I know that? Because I do more lip corrections and surgical lip reductions than probably anyone in the world, and that's not an exaggeration. I do one probably every other day. I surgically cut out permanent lip garbage. So please trust me, okay? That's the next thing that's important. So the top part has like a 3-part roll with a taper, and sometimes if it's too much aging, I do more central lip. Now the other thing that's important is to understand lips in dynamic state. When you smile, when you frown, I want the lip to look good. If it doesn't flatten, people say my lips flatten when I smile. I say, good, that's normal. When a lip stays bulgy when you smile, that means you had something done, something you don't think about. But a lip should flatten and narrow when you smile. Also, what I'm looking for is if you have a gummy smile, I can do more. If you're older, especially fair-skinned Caucasian women, the top lip starts to lengthen. And when the top lip lengthens, it covers the teeth, and I put more filler in there, it actually makes you look worse. And what's interesting is if you think about old politicians that have their, you see those photos with their teeth hanging, that usually is a lip incompetence. So when the bottom lip has more teeth exposed, it actually makes you look older. So I want to fill more on the bottom lip and less on the top lip, which is counterintuitive. And here's a good thing. When you get older, the bottom lip is actually very forgiving. I can put more on the bottom lip, make you look natural, make it look great, make you look sexy. But when I put too much in the top lip, as you mature, it covers your teeth, which makes you look older, and it makes you look not balanced. So the bottom lip is so undervalued, and I want to emphasize how important it is. When you look at my before and after, you say, Dr. Lamb, your before and afters are subtle. Good. If they're too subtle, don't come here. But I want you to understand that the bottom lip is what makes those lips look sexy when you review my before and afters. The top lip is very, very subtle, and it should be subtle, especially after the age of 35. So that's important. In terms of fine lip lines, yes, I can treat that with fillers. I do that all the time, but I do want to emphasize that you need to repeatedly inject these to get durability, to get long-lasting results. What's much better is a laser. I have great lasers that manages it, and some Botox can be a good preventative, but that is very, very important. Now, the next question is, what products do I use? So I really like hyaluronic acid-based products, Restylane, Voluma, Volbella, juvederm. Now you say, well, those are temporary, doctor. I've found a lot of these fillers, if I build it several times, they start to last months to years. Not in everyone, but I believe that this is the highest safety profile. In the past, I was a big advocate of silicone. For lips in particular, I don't use a lot of silicone anymore because I find that over a period of many years, it can slightly change adversely. So that may require some surgical reduction or injections to manage it. Whereas silicone for acne scars, I use all the time. And lips now, I'm really most focused on hyaluronic acid. If you say, Dr. Lamb, what is your impression about putting solid lip implants in? I don't like them. When you kiss someone, move your lips, eat something, it doesn't look good. Lip lifts, which is a whole different topic. Briefly, if the lip is so flat I can't see it, I'm not going to get much augmentation. And if the white lip is long, I do advocate a lip lift. But that is only if you have almost no lip. If you have a relatively full lip and a relatively short white lip length, a lip lift is a bad idea. It's going to make you look like a duck. So how do you know if you're a good candidate? You got to talk to me. Let me look at your face. Let me give you counsel. This is just a broad, sweeping virtual consultation so you understand my philosophy. The last part is I don't give you pain. If I have a patient who just wants a drop of product, I use a little cannula, I slide in here, you don't feel any pain. But the biggest pain is sticking a needle straight in the red lip. Terrible. I use a dental block in any patient that I want to do a mildly, not aggressive in terms of fake, but aggressive, like I want to do a more robust lip enhancement. I will do a dental block. If you say, well, I've had a bad dental block, Dr. Lamb, trust me, my dental blocks are amazing. You should not feel even a needle go in, barely at all. My blocks last 15 to 30 minutes in the majority of patients. If they do last you 1 or 2 hours, I can help you to change next time to a smaller dose. You should be lasting 15 to 30 minutes of numbness. It does feel weird, but pain is such a jarring thing that you don't want to ever do this again. My pain levels are close to zero, if not frankly zero, and I think that's so important. Also, my blocks have no epinephrine, so people say, hey, I'm sensitive, my heart races, I can't go to the dentist. Don't have that problem. If you said, Dr. Lamb, you're lying to me, you're totally making this up so I come and see you as a patient. Trust me, come and try me. If I hurt you, if the lip is painful, leave. Never come back to see me again, okay? I will beat any doctor out there in terms of pain control. It doesn't hurt when I do my blocks. It doesn't hurt in terms of the results. Why is pain control so important? You say, well, I don't care if I have pain. Of course you do. Number one reason patients don't come back is pain. So I hope this video, just understanding my principles of what products I use, how I do it, why I do it, what are some design principles I use, are helpful for you. But ultimately, I need to meet with you to see if you're a good candidate.